Hello, I'm really happy to be here. My name is Natasha Loder. I'm the health editor of The Economist. And this is going to be a great discussion. We're living through an incredible time of change and innovation in how we monitor, maintain, and improve our health. And new technologies are allowing us to all play a much more active role in our own care. And the panelists that I have with me today are really at the cutting edge of three key areas in advancing this health. And I have Thriva, which does blood tests at home by post. We've got Zoe, which offers personalised nutrition, and Kheiron, which has developed an AI that can not only diagnose breast cancers, but it can pick up cancers that doctors could miss. So I'm incredibly excited to introduce these three people to you. On my left, we have Sarah Kerruish, who's the Chief Strategy Officer for Kheiron Medical. Next to her is Hamish Grierson, who is the founder of Thriva. And then at the end, we have Hadjigeorgiou, who is the CEO of Zoe. Right, now what I want them to do from each of their own corners in healthcare is tell me what they think are the biggest opportunities to improve health outcomes in the coming years. And I'm going to give them 3, maybe 4 minutes just to set out their stalls, and then I'll dive into asking them questions a little bit more. But I'd like to hear what they have to say. Sarah, I'm going to start with you. Tell us about the opportunities ahead.
Thank you. I think, I'm going to start with the basics, which is fundamentally health outcomes are in direct relationship to where you live. And so I think we can't forget about the inequalities in service and providers today. And I want us to keep that in mind. But I think in terms of the work that we're doing, Kheiron Medical has developed AI diagnostic solutions that, as Natasha said, are detecting cancer earlier in Hungary and picking up 13% more cancers. So I think from where I sit, AI is going to play an integral and very critical role in cancer diagnostics going forward. It's just inevitable that, 1 to 5 years from now, whenever you have a scan, there will also be an AI read in addition to the radiologist. And it's not about replacing radiologists, it's about giving them better tools. But, in terms of cancer care, the best chance you have is of catching it early. And while we have really interesting new treatments and immunotherapy targeted treatments, actually, if you can catch, for example, breast cancer in stage 1 or 2, it's a completely different prognosis than if you catch it at 3 or 4. So that's where we're focused, early diagnosis, early intervention of cancer, starting with breast cancer. And as I said, it's inevitable that we will all have our scans read by AI in the future.
Go ahead. No, go ahead.
I was going to say the one thing that I think is really important, again, getting to this issue of disparity of health, equity and outcomes, is making sure that anyone in this space in AI is making sure that whatever we're building works for everyone, not just for the privileged. And for us, that means MIA, the technology, the breast cancer technology, working for every woman, everywhere. And what that means is a hugely diligent, many years of working with academic centers throughout the world to make sure that we have data representative of African American women or Asian women, and obviously women from all kinds of ethnic minorities. So tremendous potential. It will transform cancer diagnostics, but we have to get the basics right, otherwise that divide will just continue to increase.
Hamish, I wonder if you could tell me a little bit more about the exciting future that you see.
Thanks, Natasha, and everyone for coming along. The thing you'll probably hear a lot about in this panel, I would hope, is that the answer is simple. It's prevention and personalised medicine, or personalised health. And that as a truth has been true for a very long time, and it will continue to be true until such a time as we really do take steps towards it. Specifically for Thriva and the way that I think about the future and get excited about the big opportunities, ultimately are making the invisible visible. And what I mean by that is we, for the very large majority of the time, know nothing about what's happening inside our bodies. Thriva's created a diagnostics as a service platform that plugs into not just our own direct-to-consumer brand, but also a raft of other third parties, from clinical trials to pharmacy who want to get into allowing people to test at home. And it's all about patient-centric or consumer-centric ease of access to what's locked up inside our bodies. So we can send you a test kit at home to collect a small sample of your own blood or urine or saliva. We can send a nurse to your house. You could drop into a physical location. So why does that matter? It's my very firm belief that all of the really exciting advances in telemedicine and primary care, tertiary care, there's a rate-limiting reality, which is if we don't actually get diagnostics baked into those really consumer-centric solutions, we're going to always end up with a very dragging anchor, if you like, within those solutions, because you're still going to have to send someone off to the phlebotomist and wait 2 weeks for results. I believe that making the invisible visible is a cornerstone of enabling us to move towards preventative health.
And last but not least, George.
I mean, Hamish and I share a very similar view of the world in the future, so let me build a little bit upon what Hamish said with kind of my color on it. So first of all, if you look at the opportunity, it's huge. So moving from treatment-based healthcare to proactive, personalized, preventative healthcare, I would say it's an opportunity of 100 billion extra healthy years on this planet. And the reason I'm saying that is, imagine what the world would be if every human being on the planet get 10 extra healthy years of life. And the reason I believe this is feasible is that most of our advancement in how long we live and how long we live healthy has come from prevention. Take, for example, sanitation or eradication of diseases like tuberculosis, right?
Vaccines.
And yet at the same time, over the last 100 years, although we have improved our life expectancy based on all these advancements, at the same time, we have this onset of all these lifestyle diseases, right? Diseases that, to some part, we cause on ourselves based on the lifestyle we lead, and to an extent, they're either completely preventable or delayable, right? Diabetes is a great example of that. And hence, kind of our viewpoint is that we can start decades before a lifestyle disease arises and actually take action to prevent it. And that's what can lead to these 10 extra healthy years of life. Now, the question is how, and I think that's where kind of I want to build on Hamish's points. And my whole kind of motto around that is power to the people. Power to the people by making the invisible visible, or by shifting the locus of control from the medical system to the individual. Shifting the understanding to the human being in knowing not only where they are today, but how something will come along on the following years, whether they're more likely to get a disease 30 years down the line, and what can they do to prevent it. By shifting that locus of control, we can help more people prevent these lifestyle diseases. I'll give you two examples there. In 1965, we started inspecting our cars yearly, and now we get a real-time diagnostic about the health of our cars daily. We are putting smoke alarm sensors in our house to monitor whether there's an event that will lead to a fire. And yet at the same time, we don't do anything like that for our bodies. So our belief is that we as individuals, as human beings, we have a right to understand. It's a right to understand what's happening inside our body and then make our own decisions to be in control of our health and prevent lifestyle diseases decades before they arise.
So George and Hamish, tell me, what have you found out about yourselves using your own products?
So I'm always very, very quick to point out that I drink beer and I occasionally eat burgers. So this doesn't come from a place of piousness. So the first thing is I have a very clear sense of my sort of decision consequences. I know what my LDL cholesterol level is. I know what my HbA1c level is for diabetes risk. But one very specific example fairly recently was I got a test, and I've been tracking my B12 levels for years, unsurprisingly. And they dipped for reasons I didn't understand. And rather embarrassingly, I'm not a clinician, by the way, I found myself in my Thriva dashboard looking at my, what does it mean, like what is the low result linked to clinically, and it turns out that it can affect your nerves, the performance of your nervous system. And I'd been suffering from eye twitches for about 9 months, and they were driving me insane. I thought I had the consequence of a young family and a startup to blame for it. And I thought, well, I'm just going to go and take some B12 supplements. They disappeared within 48 hours and have never come back. So, it's a fairly inconsequential point in so many respects, given the big health challenges lots of people face, obviously. But it was just a reminder for me that I might be the founder of the business, but I'm still in need of the product.
And what about you, George? Have you found anything interesting?
Yeah, so I would say overall, the biggest change, and it's going to sound a bit simplistic, but it's very profound. The biggest change I've made is that I don't look at food, for example, anymore as calories or as food. I see it as what it's going to cause inside my body. And that awareness makes me be in control and make my own decisions, which can be very bad decisions from time to time, but it gives me the agency, gives me the control to make the decisions. I'll give you an example. One of the most profound things that I had when I first tried, when I started the company, was wearing a glucose monitor, which measures your blood sugar levels real time for a period of 14 days for its sensor. And by drinking a cup of orange juice, I saw my blood sugar level spiked, right? It didn't occur to me. I always thought orange juice is actually so healthy. It didn't occur to me that it would spike my blood sugar levels, and that instead, it's actually much better to eat an orange, which has its whole food matrix, the fiber intact, and gives you all the nutrients, but also in a much better way for your gut microbiome and your blood sugar levels.
George, didn't your mother tell you that?
I'm sorry?
Your mother should have told you that.
Well, I'll tell you something. One other big insight was I did a test just before I started the company. That led me to partially the decision with my co-founders to start Zoe. I did a test. I found that I had 0.5 kilo of fat inside and around my organs. And I went to the doctor. And the doctor gave me the standard advice, a leaflet, and told me not to eat eggs. And I started researching about eggs. And the most interesting thing that surprised me was that this whole advice about not eating eggs because they're bad for your cholesterol and lipid levels was based just on a few studies. One of them was a study from 1972, just on 12 men. 6 of the men had high cholesterol levels before the study started, and they gave them a lot of eggs to eat, and they didn't account for anything else these 12 people were doing, be it drinking a lot of alcohol or eating bacon all day or whatever that is. So these poorly designed studies from the early 70s were behind that whole kind of general advice that we're getting around eggs and cholesterol, which I was hearing from my dear grandmother every day, and in fact it's not true.
So just a quick question. When you think about kind of advancing your own areas of health, what do you think are the biggest obstacles? And obviously, you're looking at adoption by health systems, but what we have here is you're selling products to individuals. And so, are you hoping to get these things adopted by healthcare systems? So what are the challenges? And if you could reflect on, health systems as well.
Go for it, George.
I would say that I think the first challenge is that in order to deliver that vision, we need way more data around what's happening inside our bodies and over a longer period of time. So not only cross-sectional data, but also longitudinal data. And that will take time because it's hard to build hardware. We're discussing before about whether Apple or not will develop a watch-based glucose sensor. So it's hard to deliver this hardware. So I think getting that data for more areas of our body and our biology, and then over a long time, connecting it to health outcomes, that's one big obstacle. I think the second big obstacle, and it depends on the first one as well, is how can you make this awareness, these insights, the turning the invisible to visible, how you can make that affordable and accessible by everybody in the world, and not only for the people who have the means to spend. And I would say that that depends on two things. I would say the more data we have and the more technology, the more we can move from premium solutions with AI to actually much more affordable solutions, like Tesla has done with their cars, right? And the second thing, and that is actually what I find particularly exciting, is that how we might start thinking about things in the world from first principles. So we're discussing about one area that excites me a lot is the soil microbiome. How might we actually make farming and change the microbiome of the soil much better so that then the plants that we create are much more healthy at scale, that allows not only individuals but also the animals to eat much more natural and healthier food, and that by implication makes the world healthier, and even people who cannot afford the expensive stuff.
Hamish?
Yeah, to riff on that a little bit, I mean, I think that it's never been more powerfully true that health is now really economics, in the sense that COVID made plain, were it not obvious before, that when you knock out X% of the workforce, that has a direct economic implication, and or you've got to fund the care of those individuals in a particularly high-cost way. So, the crude answer, I believe, is ROI calculation and proof. That is the thing that I think is coming. But all of that is true. You need more data. You've got to wait for the computational models to have the data and then actually be able to evidence that the thing that you'd suggested did something good in the world and that actually did lower costs. So, from our perspective, we actually do supply into the NHS and we do supply into the private markets as well. And ultimately, actually, the private markets, you don't need to convince around the ROI directly. But if you have a longer term ambition to, key into the one single big provider in the NHS, of course, it's going to be all about ROI.
Right. So it's about the money. Sarah?
Well, I think for us in AI and healthcare, the biggest challenge we face is that healthcare systems don't know how to assess AI in terms of efficacy. So the randomized controlled trials of the pharma industry are not suitable for evaluating AI. We need to move to a real-world evidence base and look at, it's very easy to see how an AI is performing at an actual site. So we need to move away from the old model to a new model of evaluation. And it's not just about adoption, it's about monitoring. So AI drifts. So if, depending on the hardware, depending on all kinds of factors at a site, AI performance can change, sometimes for the better and sometimes not. But people evaluating AI, bringing it into healthcare, need to look at the real-world evidence, and they need to make sure that whoever the provider for that AI solution has a monitoring solution in place and can actually see that drift of the performance of the technology.
I found that particularly interesting because I'd always imagined that you would invent some AI technology that would diagnose something, you'd put it in a hospital and you'd walk away. But what you're saying is that actually these systems change their efficacy over time, which means it's kind of like an ongoing process to make sure that the AI is doing the right thing, that it's not biased, that it's not diagnosing the wrong sorts of things. So that is quite a challenge. Is there a risk that we could learn too much about ourselves? I mean, perhaps not with breast cancer, but certainly I'm minded with a lot of these at-home tests is that, I'm always reading stuff. I mean, aren't you creating an army of worried well of people who are, taking their blood every week and, worrying about the donut, although we probably should worry about the donut, but that's, I guess,
or maybe not.
Or maybe not, actually, yeah. How do you feel about all this data? I mean, I heard someone speaking yesterday who was talking about, predicting when we're going to die, and I'm not sure I'm ready for that.
I'd like to know, does it make you more neurotic or less neurotic over time? What's the course of the journey when you're testing yourself all the time?
Look, my experience is less neurotic by a factor of 10. But I want to be really direct in the answer. There is a huge risk. Yes, we should just be open about that. Because the reality is, I'm a massive, at least in various parts of my life, anti-technologist. We've adopted technology without considering the implications of it. Thankfully now, the challenges with AI, I think, are helping us reframe some of what we have the ability to do and question whether we should. So I really do. I do sit with that question as a good one. What we ultimately, I think, all have to hold ourselves accountable to is the knowledge that people may end up psychologically in a place that you weren't intending them to be, and therefore to build into your product the safeguarding that prevents that from being true. So in our case, we have a much lower cadence of testing. There are use cases where people do test every couple of weeks, but they're typically within primary or secondary care. It's very unusual, and we would pick it up as a safeguarding risk if someone was testing, frankly, much more regularly than their biomarkers are actually going to change, right? So there's just a sort of biological truth that we build into the way we think about the safety and the governance around it. But yeah, the experience that our customers have is profoundly positive for the simple reason that they go from nothing in the main to something, and the degree of regularity with which they get that something is appropriate, we think.
I mean, the one thing I would like to add is that it's a great question, but I think we should also be a bit pragmatic. I mean, let's look at the world today. We live in a world where Dr. Google is accessible to everybody on the planet. People type on Google, they try to find information, they get information, and in many cases, very confusing information about what's happening in their bodies, right? So that is the baseline. So the question is, can we provide these people more power, better insight, and something that tells them basically the truth of what's happening in their body? And I think that's where the opportunity lies, and I would say that one of the beautiful things about this new AI wave is that it's fundamentally shifting the architecture of the web in a profound way from something that was a search bar with blue links, sometimes advertiser links, to something that is assistant-based. And we're going to have a general assistant, like some people have their assistant, and we're going to have specific assistants, right, around travel or around health or specialized areas of health, right, or breast cancer or whatever it is. And I think the opportunity is to give, again, the power to the people, and with these assistants, with the right type of data, give them much more powerful insights about what's happening, but also give them the controls and the choice for them to decide whether they want to use it or not. But I would say that is way better than what is happening today, which is still kind of access to a lot of misinformation about what's happening in their health.
So what you're talking about is like perhaps a personal AI health assistant that would essentially sift through your data and provide kind of actionable information and maybe ignore some of it.
I think we're heading that way, whether it's going to be one or many, to be determined, in the same way that you have many different types of doctors. You may have more types of assistants. But I would say fundamentally, that is the whole wave where technology is shifting. We're shifting from a search-based paradigm to an assistant-based paradigm.
I think, if I may just, Natasha, briefly, I have a real problem with the concept of the worried well. It's a phrase you hear all the time in healthcare. And actually, when you think about the statistics, they're very clear that if the people who are worried were as well as we all think they are, then we probably would have increasing health span. And actually, I think we need to just come up with better terminology to describe the fact that there are, yes, a probably pretty small group of people who are totally fine in that particular moment and are still worried about it, and they need to be helped to understand that they shouldn't be worried, but that equally, in 2 years' time, their physical state may have completely changed and there is a legitimate reason for them to, at that point, take an action. But that the vast majority of people where the opportunity lies know nothing. They maybe can and should be given access to information that I think could have a very profound implication. But they also get bucketed in the worried well, because they are, if you think about where that term grew up, it was against the idea that you were either sick enough to end up in a doctor's surgery, or you were worried well and therefore outside. And we have to shatter that dichotomy, because you're on a spectrum. It's not binary. You oscillate up and down depending on where you are in a given period of your life.
But I mean, obviously the NHS is very overstressed, and you don't want people turning up at their doctor's surgeries with information that they don't understand or that they've interpreted correctly. So there's a lot of onus on, presumably, the people who develop these tests to give good information. I mean, years ago, I had my full genome sequenced for a story by Craig Venter, and they said, you have a gene, a cardiomyopathy of clinical significance. And I said, oh dear, what does it mean? And they said, we don't know. And that wasn't very helpful.
Yeah, there is a risk of that. And just to be sharp on the point, it is incumbent on the businesses that are trying to create solutions to tune into that. So, for example, we have a GP review and comment on every single result that we put out. We have proprietary technology that is evidence-based, that's regulated by the MHRA, so that if we're saying something about a result, it's based in the latest science, and it gets reviewed all the time. So will there be a bit of a Wild West growing up alongside the businesses that are frankly taking the harder path? It's already there. That's already something that you can see.
Yeah, that's definitely my feeling, is that there's a lot out there which you just don't know how to assess the quality of it. If you go on the internet, there are all sorts of tests being offered. I guess one of the things that we talked about health inequalities, and I suppose with services such as yours, I mean, if they're not integrated into the NHS, won't you end up with a situation where you're exacerbating health inequalities because people who can afford these tests have powerful insight into their health, and people who can't or are not introduced to them by their doctors won't get that advantage?
It's a great question, and one that's very dear to my heart. So in our case, from the very beginning of the company, it's something that we had really thought about in terms of providing accessible information to everyone. So if you think about how we set up the company, we do a lot of research. We have more than 30 peer-reviewed papers. All of them are public information with new insights around the science we're developing, around the microbiome, around health, around nutrition. We launched the Zoe Science and Nutrition podcast. It's one of the top podcasts in the country. Again, in order to be able to share all the information with everybody and make them aware of what's happening in their bodies in general. And our overall view has been that the more data we collect, the more we can use technology, the more we can lower the price of our services to make them accessible for more people. And so now, of course, our tests cost £300. I would say in the future, with more technology, more predictions, you can lower the cost to make more people able to access them.
And Sarah, I wonder if you can reflect on what it's going to take to encourage the NHS to adopt technologies like yours. I'm minded that the doctors haven't even got AI transcription yet. They're still having to hand transcribe notes.
Yeah.
It's exhausting. I mean, this is such a basic technology. So if we can't take the workload off them to help them with their transcription, how are we going to get technologies like yours introduced more widely?
Well, the way that we've approached it, apart from having a robust body of evidence, we think the most comprehensive in the world to date in terms of breast cancer diagnosis using AI, we believe in just getting the technology in the hands of physicians. So I was on a call yesterday where we were reviewing results of Gateshead, a hospital in the northeast, and we'd been reading all of their breast cancer results alongside the doctors for 6 months. So we could tell them exactly how Mia was performing and get their feedback. And their feedback was overwhelmingly like, this is amazing. This is going to exactly help what we need. In breast cancer, there's two radiologists read every scan, so radiologist plus Mia is a great combination. So I think that's what it's going to take. And it's also going to take people in policy and in government who understand how to evaluate AI and to be able to tell which ones really do work. Because it's one thing to get an AI that works in a lab on a limited data set. It's an entirely different thing to get something that works in the field and generalizes to different populations. So it works in the Northeast and it works in London. So I think those are some of the things we're going to need to make sure that we adopt the technology, the right technologies into the NHS.
Well, look, we're running out of time. We've almost finished. So I just want to thank the panel and say, this is a really exciting time for all of us. The NHS has huge challenges at the moment, but I think it's incumbent on us to be interested and aware of these technologies and ask for them and, insist that our politicians spend more time thinking about prevention rather than dealing with the crisis that we have now, which is of an increase in waiting lists because we have, this chronic burden of disease on our society. Anyway, with that, I ask you please put your hands together and thank the panel. Thank you so much.
Thank you.